Hi, Jessica. It's so good of you to come in today. I see that you're concerned about a possible lump in your breast. And you know what? We can navigate that today, no problem. I'm going to ask you a few questions, and then we'll do a breast exam just to kind of confirm what you think you're feeling. And then I'm going to show you how to do a breast exam on yourself and the couple different ways you can do that. Does that sound good? Okay, great. So a couple questions that I'm going to ask you are: when did you first notice the lump? And has it changed in size since then? Is the lump painful or tender to touch? Do you notice any nipple discharge at all? Have you experienced any changes in the skin around the lump? Any dimpling or redness, thickening, anything like that? Is there any family history of breast cancer or any gene mutations that you know of? Um, and then do you perform regular breast exams on yourself? And then when was your last menstrual cycle? Sometimes lumps can be cyclical and they're just kind of like little cysts that are benign. And so we always like to make sure that we're on the right trajectory. Have you had any recent breast trauma? Any sort of like if something's hit you, or maybe were in an accident or anything like that where there was like trauma to your chest area? Are you breastfeeding or pregnant? Because that can also change the shape and lumps and bumps of your breasts. And then have you noticed any other symptoms like weight loss, fever, fatigue, feeling run down, anything like that in association? Okay, so the other thing we're going to do is we're going to demonstrate and show you how to do, or I'm going to do on you a breast exam. Oh my gosh, puppy dog. Sorry. And then we'll do just what's called a clinical breast exam. So just what I will do for you here. Okay, so first, what I'm going to have you do is I'm going to have you sit or stand with your arms just relaxed. And we're looking at the breast for any sort of skin changes or asymmetry, any dimpling or nipple discharge while you're sitting here. Next, I'm going to have you raise your hands above your head and then press your hands to your hips just like this. And then we're going to fully lean forward. And what we're going to be looking for is the contour of your breast to see if there's any part that stays more flat or pulls in as you move around. Okay, so now I'm going to have you lie back. So let's pretend this is a breast, okay? I'm going to have you lie back and we're going to have you put one arm behind your head. So in this case, we're going to have you put your left arm behind your head and we're going to examine your left breast. And so I'll use my fingers and I'm going to go in small circles around, this is your nipple. So we're going to go in small circles kind of around your breast. And I'll just use my two fingers and the pads of my fingers. And so we often use a circular pattern to make sure that we check the entire breast area, including up to the collarbone. So like all the way up here and all the way into the armpit, because you have lymph nodes and different things. And so I'm going to go see, this is a circular technique. We're going to go all the way around. And then we're going to look at your nipple. So we're going to gently palpate right around your nipple to check for tenderness or any discharge that may come out. And then I'm going to palpate underneath your arm, so here, and we're checking your lymph nodes just to see if there's anything swollen or painful through here. And so that's how we're going to do that. And then teaching you to do a self breast exam. You're going to stand in front of a mirror with your arms down to your side and then raise your arms. And then you're just going to look to see if there's any breast changes or anywhere that the skin dimples or seems tight and that doesn't just look like it's sitting naturally. Then I'm going to have you lie down on your bed and you're going to check, you're going to have one arm up and around, and then you're going to take your other hand and you're going to palpate all the way around and to feel using the pads of your fingers just like I did on you, and you're going to feel around your breast. The other option is to do a shower check, and it kind of works really great because the shower, your skin is more slippery, so it's a little easier. So what you're looking for are lumps, thickening in the skin texture, changes in the skin texture, any asymmetry that's not normal for you, nipple discharge, and then I always recommend doing a breast exam once a month. All right, thanks.